What's happening, everyone? Dr. John Schott here with Balanced Physical Therapy. So today I actually wanted to talk about what is called femoral acetabular impingement, or short term is FAI. So I've had a number of patients who have come to me recently with this condition and just general questions about it as well too. So if we take a look at this graphic here, we can see that with FAI, we can have two different types of deformities. We can have a cam deformity, which means that the head of your femur is essentially too large for your acetabulum, which is the hole or the socket that is in your pelvis for the head of your femur to fit into. We can also have a pincer deformity, which means that the acetabulum essentially comes up more around the head of the femur and it pinches with the femoral neck. So the biggest thing about both of these conditions is that we can end up having something like a torn labrum. Very common for athletic population to experience, and just as we get older, because it can be almost sort of a wear and tear type of thing, especially if you have one of these types of FAI. So especially if we are coming in for hip pain, you maybe go see the orthopedist. They say, oh, let's get a MRI. With the MRI, that can confirm that you do actually have a tear in your labrum. So the important thing to consider with this as well too is, from an outcome standpoint, how this can be treated. So there's different ways. We can do actual surgery to repair your labrum. You can do an injection, something like cortisone, to help decrease inflammation essentially in the area, or you can do some physical therapy as well too. With looking at the surgical outcomes, we've seen that it is really hit or miss with how you're going to recover after surgery and if you are actually going to have reduced hip pain. Looking at something like a cortisone injection, it might give you some immediate relief, but it's not able to address what the underlying issue is, which is that you're getting that pinching in your hip. And then we have physical therapy, which again, we can't, as a physical therapist, I can't change your anatomy. I can't make it so your hip isn't pinching. However, we can work on strengthening of certain muscle groups, mobilizing your joints that are going to give some relief to that pain. As someone has had FAI for a long time and periodically has issues with it that arise primarily after certain workouts, certain activities, where the next day, my left hip, it'll just bother me a bit. I just feel this really kind of localized pain in the front of my hip. So what do? Well, first of all, I think about what I did. Was it that I was, cycling a lot and that repetitive movement really bothered me? Was I doing some deep squats, something like that? Whatever it is, finding out what the motion is that can be the provocative motion, but then also taking some time off from those types of activities to get back to the foundational strengthening. Doing lots of proximal hip girdle strengthening, sidestepping, clamshells, exercises where you're opening your hips up rather than going into a closing motion like a hip flexion, hip adduction, where you're getting compression on the inside of the joint. You can refer to some of our other hip strengthening videos that we have on our YouTube and Instagram channels that have various exercises that you can do for working on that hip strengthening. If you found this information helpful, please make sure to follow us on Instagram and Facebook at BalancedPTMove. Give us a like, follow us on our YouTube channel as well. Thanks.